Welcome to the Health AI Brief, breaking down the AI shaping our world one concept at a time. We've talked about how an AI model learns by trying to minimize its error step by step, but how is that learning process itself designed? For instance, in our gradient descent example in the last episode, what decides the size of each step, the learning rate? Is that something the model learns for itself? The answer is usually no. It's a setting that the data scientists have chosen before the training even begins. These kinds of settings, the ones that configure the learning process itself, are called hyperparameters. The best analogy is setting up the protocol for a clinical trial. Before you recruit a single patient, you have to make crucial decisions, like what is the dosage of the drug we're going to try, how often will it be administered, what are the inclusion criteria. These aren't results that you discover necessarily during the trial. They're fixed rules that you establish beforehand that govern how the trial will run. Hyperparameters are the AI model's protocol. They're the knobs and dials on the outside of the learning algorithm that we have to tune ourselves. This includes things like the learning rate, the complexity of the model, and how many times the model gets to see the data. Choosing the right hyperparameters is crucial, and it's more of an art than a science. Researchers often have to run their experiment many times with different combinations of these settings to find the ones that produce the best performing model. This process is called hyperparameter tuning, and it can be one of the most time-consuming parts of building an AI model, but one of the most important. Understanding hyperparameters is key vocabulary for being able to interpret decisions made by researchers when they're building a machine learning or AI model. It hopefully helps you appreciate that building a good model isn't as simple as just throwing data at an algorithm. The researcher's skill in tuning these settings plays a huge role in the final outcome. Think of it as a surgical technique. The same tools can produce very different results in different hands. Next, when you read a methods section, look for a description of how hyperparameters were chosen. Did they just pick some default values, or did they perform a systematic search for the best ones? Terminology like grid search can be indicative of that, of systematically trying different hyperparameters to see how they perform with different models. Good papers will be transparent about this process, and it's a hallmark of high quality, rigorous studies. And then finally it explains why you might get two different research groups using the same data and the same types of model but end up with very different results. The choices of hyperparameters could be the key to these sorts of differences, and it's a really important step. So that's hyperparameters in a nutshell. They're not part of the model itself, but the critical settings that dictate how the model learns.